So we're with Bill and Art from Port Jeff Physical Therapy. We had a couple of questions for them. Bill, basically, your training and experience as a physical therapist, where did you have to go to college for this, get special certifications?
Well, physical therapy it's similar to other specialty schools. Oftentimes you have to have a bachelor's out of a college and then apply to get into the program. And it's a physical therapy school taught by physical therapists. Typically today it's a doctoral program where it would take 3 years beyond your bachelor's and you end up with a clinical doctorate.
Now, do you have to get recertified every couple of years as a physical therapist?
What we're required to take continuing ed courses, so we take 12 of those courses, 12 credits per year, so about 36 credits in 3 years when our license renews.
And Artie, is there any additional training that you need to become a physical therapist?
You can take specialties, orthopedics, geriatrics, pediatrics, so whatever your excitement is, wherever you want to be, that's kind of where you would kind of discipline yourself.
Yeah, once you graduate, then it's really up to you what you want to focus on. There's a lot of little different niche type practices in physical therapy. Like Art was referring to, you can work with children, work with geriatric patients, work at a nursing home, work in a school, work at people's houses, go to home cares. It's a broad variation of fields you can work in.
Now, we were talking before the program about the opioid crisis, and majority of doctors now are not prescribing pain pills, but are prescribing physical therapy. Can you tell us a little bit more why that's a better choice?
Well, it's a choice that the patient has to make because it's a bigger investment in their time, the rate of I guess the recovery rate is going to be a little slower, but more permanent, unlike taking a pill, where there's a very high addiction rate.
Right, so the pain pills never cure the problem, they only mask the problem. And with that, the problem is always underlying, is always there. You may minimalize it, but it doesn't really resolve the problem. And that's where we come in. We try to evaluate and determine where the problem is, and if we can help you fix it, we will. Usually manual techniques we use, therapeutic exercise, gentle exercise, range of motion, to try and restore your normal mechanics of the body and hopefully resolve your pain.
Now, when a new patient comes in to see you, what's the first thing that's going to happen? Give us a step-by-step.
First thing that happens is you fill out a lot of forms, as in every medical office, to determine where you are medically. Your medication, your past medical history, what your complaints are today, what your goals are, what you can and cannot do. And from there, maybe medical tests, some x-rays, MRI findings. We glean information that we deem pertinent, and then we'll do an evaluation. We'll sit in a room and we'll interview you and determine what best course of treatment to follow. Then after that, once that is concluded, then we will go to the physical exam. We'll palpate, which means touch your certain areas that are painful. We will check your range of motion, how much your extremities move or your spine moves. We'll check your strength to see if you have normal strength or if you're compromised. And from there, we'll develop a treatment plan based on what we find with you.
Now, how many years experience do both of you have in physical therapy?
Almost 20 as a physical therapist.
Yeah, right around that time period.
And Art, this question's for you. What type of injuries do you usually see the most of?
So we have two offices. One office is mostly orthopedics, so we see a lot of the surgical patients, the hip replacements, knee replacements, shoulder replacements, rotator cuffs, sports injuries. In this office, we also have your run-of-the-mill sprains and strains. Balance issues are a big problem, especially in our population here, which is a little older. That puts them at a greater risk for falls.
And we do see a lot of patients that are being treated by pain management doctors. So those are the patients that are typically older, that have pain that usually is there. It starts with their spine or extremities, and they're being treated by a pain management doctor through injections typically, or oral type of medication. And again, that doesn't cure the problem. That just tries to help. Typically, the pain management with the physical therapy work very well hand in hand.
Can physical therapy help everyone?
To a degree. Some people are beyond what therapy can provide. They may have to have a surgical intervention, but everybody that does increase their strength and their range of motion, if they have to have surgery, will do better, maybe faster, and have a better recovery if you invest a little time beforehand. But most of the time, yes, the research shows that the therapy is beneficial.
Right, it won't cure all the problems, we know that, that's why there's sometimes people have to have surgery, but it definitely will make things better.
Now, is it possible that these new techniques that they're coming out with are going to be applied to physical therapy about certain movements and certain ways to manipulate the body to sort of like get it back into swing of its normal rhythm?
Well, we're learning research every day, and there's mounds of research about mobility and strength training that has been going on for quite some time. These are evidence-based trials where they take a control group, an experimental group, compare them side by side, and from there they'll get some information, and they determine that oftentimes the right kind of exercise, the right dose, the right quantity will improve you as a person, as your mobility. We all have the same machine, you know, we all have the same legs and the same arms.
Now, what is the recovery rate for most patients?
It's really hard to kind of pigeonhole a question like that because people that come in are at different ages and different strengths and different places in their life. So not everybody's going to recover at the same rate. You know, there's a spectrum of recovery, and typically if it's a prescription for post-surgical, we follow the prescription that determines their recovery rate, but not everybody recovers at the same rate.
Now, would the recovery for, let's say, a knee compared to a back be way different or similar?
It's a trick question.
Yeah.
People will recover at different rates.
Yeah, it depends on the individual. Pre-morbid condition, the condition you're in prior to the injury or the surgery, is a great dictator of how you will recover after the injury or the surgery.
Well, what percentage of physical therapy patients benefit? I mean, what's the recovery rate?
Well, 100% will benefit, but not as everybody is. If they needed surgery, some will still require to have surgery or other interventions.
Now, you were saying before, I just wanted to bring this up again because it is a big subject, about the opioid drugs versus physical therapy. With the opioid drugs, you're really not healing the body, you're just
Exactly.
hiding the pain?
Masking the pain. And there's a lot of research that thinks that the brain is so intuitive that when you're taking this medication, the brain realizes an underlying pain, so it kind of amplifies it. So imagine going in your car and turning on the car and the volume is up to 10. That's what happens when people go off the medication or the medication starts to wear off. So they have to retake the medication to turn the volume down because the receptors, the parts of the body and the mind that read what's going on, has gotten so sensitive that it's hard for them to live without the pain medication.
Now, also, is treatment basically the same for everybody? Let's say a knee problem is a knee problem, no matter who it is, a back problem is a back problem, who it is, or is it all specialized individually care?
There's you know, you come in with knee pain, there's a few things that we have to evaluate: your range of motion, your strength, age is a factor, your conditions prior to coming in. Are you an active person? Are you sit at a desk all day long? So not everybody will start at the same place. Some exercises are going to be deemed more for an athlete, some maybe for a grandmother. They will not be doing the same thing, but they're all going to get the same basic exercise, range of motion, and strength for their outcome.
Now, also, there are certain like electronic devices like TENS units and stuff like that that you can use to help aid the body along with these exercise programs that you're doing. Do you guys use that equipment a lot?
Yes, we use it for pain. It's an holistic way of managing pain. You avoid narcotics, very similar to what massage would do. or any other kind of holistic treatments.
The electric stimulation is becoming so popular now. There is a whole branch of pain management that'll actually install the electrical stimulation inside your body. And it'll be on all the time, 24/7, and help you deal with your pain.
And again, it's not addictive, and it has an equivalent. I believe I read somewhere that like a 20 minutes on a TENS unit is equal to like a 2-hour massage, something like that.
I'm not sure of that, actually. Yeah.
Are most of the injuries you see age-related?
No, car accidents, slip and falls, sports-related, post-surgical. No, there's a big gamut of the type of services we provide.
Right. Accidents, trauma.
Again, going back to when a patient first comes in to see you, do you explain to the patient what is wrong and what is injured on them?
Oh, sure. We want them to understand what to expect. And so you got a patient coming in who's in pain, and we're going to ask them to do certain exercises that may increase their pain, but we have this nice chain of communications that if it does increase the pain a little, to let us know, but there is, it's a necessary evil in order to get better. So yeah, there's constant contact.
I think that's where we work well with physicians. Physicians' demands for time are so high that they can't really spend a lot of time with the patients. Where we can spend some time in the room and we answer all your questions in the exam room. And when you come out here, we're working with you. So we'll continue the conversation out here. Any more questions you have, oftentimes someone will walk in and ask me follow-up questions. Maybe they looked online or they talked to family members, and then we'll complete the routine while we're talking about what your problems are, and answer and give you any information you need.
So basically, when a patient comes in, they're getting customized individual care, and that one, like Art was saying before, that one person can be totally different from the other, even though they have basically the same ailment.
Exactly.
Absolutely.
Yeah.
Now, what exactly is evidence-based treatment guidelines? I've heard that expression. I have no idea what it is. Maybe you could help out the public and tell them what that
Well,
is.
it kind of goes back to what we were saying before. So they do studies, just like they do studies for medication. What they'll do is they'll have two groups, a control group and an experimental group. And from these two groups, they'll put one group in, say, an exercise class, one group in maybe just a education class, and maybe 6 weeks later they'll do a re-examination and see what works best for the patients. And oftentimes, like I said, have mountains of evidence that prove that exercise is ultimately the only real true way to change tissue texture, which I mean get you stronger, get you more flexible. Some thoughts are it's the closest thing you have to the fountain of youth. If you look at some people who are older and they move well and they're still active, what have they done all their life? Exercise. That doesn't mean going to the gym to become like Arnold Schwarzenegger. That means just keep moving, doing some kind of resistance base, some kind of aerobic base, some kind of flexibility exercise, just to keep your body moving well.
Our next question is for Art. I've been asked this question myself. I really don't have the answer. Is all physical therapy all exercise and that's it?
Exercise is a big part, but the hands-on, the manual, the stretching, the massage is a big part of it as well. So no, you just don't come in and exercise. If that's all you need, you can just go to the YMCA. We need to have, it's a prescription. You follow a prescription like you would an antibiotic, you follow the same prescription of therapy. Your exercises are laid out for you, your services are hands-on, you have stretching, you have massage, you have the modalities, as we spoke of earlier, the stim, the ultrasound, heat, ice. It's not just exercise.
No, the exercise, like we said, that's really, I would say, the meat and potatoes of what physical therapy is. But I think most recently is the hands-on is becoming a lost art, which is very important for each patient to get that customized, either massage, like I was talking about, the stretching.
It's time-consuming, so a lot of people leave it alone.
Right.
Now, earlier today, Art, we had actually taken some footage of you working with a patient, and we noticed it was almost as if you were handling an infant, how gentle you were with these patients, and you were helping them with their movements, and you're also doing this type of massage to them with your hands.
Yes, that's the manual part. Remember, these people are in pain, and you have to treat it like you're holding a porcelain doll because they're hurting. They're giving up their neck, which people are most sensitive about.
Yeah.
So, you know, you really have to take your time and be gentle and give them that ease where they can actually truly relax in order to find what's the root of their problem.
Right. Sometimes the first 1 or 2 treatments is just the patient getting to know you and your touch and
Mhm.
what their expectations of the therapy are going to be, you know, so that they can get kind of more relaxed and in a comfort zone and know that they're going to be helped.
Well, my last question for you has to do with fear. Now, what would you say to people who are afraid to come to physical therapy, but their doctor is definitely recommending it?
You know, I understand the fear because, you know, PT has gotten a rap that it's got to hurt. I hear that almost once a week from a patient. And my thought is, it always goes back to the patient, it shouldn't hurt. I mean, it's therapeutic exercise. These are exercises that are gentle exercises. Massage shouldn't hurt, especially when you're in pain. I don't believe that it should be painful. It doesn't make any sense to me to put you in more pain when you're already in pain. So our goal is, on the first visit, to have you walk out in less pain than when you walked in.
And also your follow-ups that you do where you actually have the patients do homework sometimes for their physical therapy?
Oh, sure. We have a nice program where we can send exercises to your phone, your computer, your tablet, and it's a step-by-step program.
Yeah.
So a lot of times you would be given a piece of paper, and you can mess up, right? It's hard to remember what I did 24 hours ago to reproduce it at home, and I'm going to come in and my shoulder hurts. That's because you probably did the exercises incorrectly. So we give you this program that you step-by-step watch someone doing it, and all you have to do is
You can do it with
mirror
them.
the image.
Right, you can do it with them.
Yeah.
You can do it,
So
you
it's,
know, after
it makes
you watch it.
makes it a lot safer.
Yeah, definitely. And it's customized. Again, it's not, everyone doesn't get the same one. We go through it and we take our time to pick the right exercises for
The way
you.
insurance is now that people are limited with their benefits, so they have them do more exercises on their own, seems to help
Right.
the recovery.
Just as long as they're doing it the right way. Like we
Most
said,
important.
years ago, we used to give people a piece of paper. Well, that's not really a great way to
Mhm.
learn something for a lot of people. But to watch someone do it and be able to mirror that, I think that really helps a lot of people.
My last question would be, as I wrap this up, is that if there's a new patient who's out there who's watching this video, what makes Port Jeff Physical Therapy a cut above the rest? Why should they come here?
Well, we are the owners and operators. We are hands-on. We are here.
All the time.
You'll only see us.
Right.
You'll never be bounced from therapist to therapist.
And it's like a family here, which is one of the things I hear from a lot of patients. They really like the idea of, you know, the continuity of care is important. They're here, we make them feel at home. We never make anyone feel bad if they can't do anything. We're very in tune with people. We don't want to make anybody embarrassed or feel like they're not doing things right. So we take our time and we tell people, don't worry, you know, and that's the way life is, and that's the way therapy is. It should be a welcoming environment. This is a healing environment. We don't want any negativity in here, and that's what we really strive for. Even if we have someone who gets upset, we try to take them aside and foster that positive reinforcement so that they will learn that they can do it. It just takes time.
Again, customized individual care is what it's all about.
Absolutely.
And you guys are not owned or operated by any corporation. You're not a member of any major medical group.
We stand alone.
And that is what gives you the individualized care. And I wanted to thank you guys for sharing some time with us and to the public who may be watching this video about Port Jeff Physical Therapy. Till next time, I'm Larry Mike Arinda. Take care.